So the national capital, Delhi, has reported its first case of monkeypox today. A 31-year-old man with no foreign travel history was diagnosed with the disease after he caught fever and skin lesions. Now, this is the fourth monkeypox case that has been detected in India, with the previous three being reported from the southern state of Kerala. Amid these rising cases, government at the centre has advised screening first international passengers. 16 laboratories across the country are now dedicated specifically for monkeypox, including 2 only for Kerala. But importantly, the World Health Organization on Saturday has declared the international monkeypox outbreak as public health emergency of international concern. Now, these are some of the symptoms on your screen of fever and headache that have now been emerged and reported: back pain and muscle aches. Read carefully, because while not trying to cause any sort of panic, it is important that if any of you are, as the experts are telling us, feel these are some of the symptoms, then it is worth immediately considering medical help.
We have an outbreak that has spread around the world rapidly through new modes of transmission, about which we understand too little and which meets the criteria in the international health regulations. For all of these reasons, I have decided that the global monkeypox outbreak represents a public health emergency of international concern.
And just to get all your concerns and questions addressed, I'm now joined in this special telecast by Dr. Manoj Goel. He's the Director of Pulmonology in Fortis Memorial Research Institute. Now, Dr. Manoj Goel, thank you for speaking to me, because with the COVID pandemic that spread, you've clearly been tracking what, it made a lot of concerns, worries for people across India. Now, the first question here would be, what are the identifying symptoms that you're picking up on? Because does it, like the COVID pandemic or the coronavirus spread, hits the respiratory system as well? Or is this different from the coronavirus that's been around us now for 2 years?
Pooja, the thing is, there is no need to panic at all. It is much more different than the COVID or the coronavirus. The infectiousness of this virus is much, much lesser because it doesn't spread by air. The COVID virus would, spread by air. And the main source of, COVID infection is the respiratory droplet infection. And that would happen very small, close contact of a, very small period, say 15 minutes or so. Here, basically, the mode of transmission is basically skin-to-skin contact, close contact. Respiratory droplets can be one of the measures of, transmitting the disease. But primarily, it is the close contact, the skin contact with this, infected secretions of the patient, or if there is, face-to-face contact for maybe a few hours, 2 to 3 hours, not 15 minutes, which could be the things. So I think it's definitely not as serious issue as
then tell our viewers watching this right now, are the identifying symptoms that if you're feeling any of this, or if your body is beginning to show any of these symptoms, it's important to immediately contact the nearest doctor?
So first thing is that, we have to understand that India is not the endemic country for monkeypox. It is the African countries which have been the endemic for monkeypox since 1970s or so. So international travel within 21 days is very important. So somebody who has traveled within 21 days from abroad and is developing symptoms like fever, headache, body ache, some skin rashes, lymph nodes, the nodules around the neck, then these would be the symptoms where one has to, report to the authorities. So I would suggest international travel within 21 weeks and presenting with fever, headache, even though the patient may not be having any typical skin rashes or lymph node, he must report to the authorities.
Dr. Goel, just to help understand what the symptoms may look like, is this similar to, let's say, someone who's got a chicken pox, the manner in which the skin rashes start to show, or smallpox that has been eradicated though, but can we say that it does sort of look similar if that is happening on your body?
It is different actually, because here the lymph nodes appear. The nodal involvement is very important, one of the characteristic features, apart from the other viral symptoms like fever, headache, body aches. The distribution of the vesicles or the rashes is also a little different. It will start from face and from the legs, and then it will come on to the tummy or other areas. So it can be easily identified. And at this point of time, when the monkeypox is becoming pandemic and is already involved on 75 countries, I think anybody who is coming with skin rashes, with fever, with viral symptoms must be screened and diagnosed for monkeypox.
So now do tell us, doctors, about specific precautions that we can take. And are these precautions against monkeypox similar to that against coronavirus? Because usually we had a certain layout of the precautions we need to follow. Do we think it is similar to that? If you can update our viewers watching right now about precautions that they need to take, must take against the monkeypox spread.
Largely similar, and I would agree with that. But apart from that, this would include, avoiding contact with the patient, wearing protective, personal protective equipment while, visiting this patient, particularly healthcare workers. They should avoid, skin-to-skin contact, any intimate contact, particularly if the patient has, history of travel within 2 to 3 weeks and is showing symptoms. And the handling of the secretions should be done very, very carefully by the healthcare workers. One should not come in, contact with those infected material, infected linen. And if, of course, it is again, as I said, not endemic in our country, but if some animal like, meat handlers, they must be really careful, of course, while handling, if it is suspected to be an infected animal.
All right, so it is infectious, and specifically around whether it's linen that's used or other material that needs to be what the caution and precautions need to be followed. Please stay on with me, Dr. Manoj Goyal, because I'm also now joined by Dr. Suresh Kumar. He is the medical director at the LNJP Hospital, where the first reported case from Delhi of monkeypox is currently being treated. Dr. Kumar, thank you so much for talking to India Today. Let's begin first. What precisely can you tell us about this case, and that can help update our viewers and also help them follow with precautions, sir?
We got this gentleman admitted in our hospital 2 days back, and this particular patient had a history of fever 10 days back, and then he had a skin lesion typical of monkeypox. He had typical vesicular and vesicopustular lesion in the lower limb, thighs, thorax, abdomen, over the face, and also on the palms. So we had a high level of suspicion that he might be having monkeypox.
Yes.
We sent the skin scraping and skin sample to the National Institute of Biology, Pune, along with the blood test. And today we got the report that he is positive. Right now, patient is stable. His vital parameters are well, and he is recovering. But we have seen the first case after we have the alert from Kerala that first case was detected in Kerala. We had a high-level meeting, and Delhi government given us the direction to prepare an isolation and treatment facility. We have trained our doctors, resident staff, nurses, paramedics that if any patient...
Dr. Suresh, what you're telling us is very important, because you are the doctor who is currently taking care of that patient, and I'm glad to know that he's recovering. I'll just come back to you, sir, because we'll connect that and correct that audio line. There seems to be some issue with it. Please stay on. I request my producers to arrange that. But Dr. Goyal, what he's also saying is very important. It started from Kerala, and this Delhi case actually had no travel history outside the country. And this has been, as it appears, a domestic issue. So how are we looking at the infection of it and the fatality aspect of it? Is this fatal? Because everyone has their alarm now up. Is there a strain in any country that is proving to be deadly here? What would you want to tell the viewer right now about the fatality aspect of monkeypox specifically?
See, again, these are early days, but as it is, monkeypox causes a very mild disease and very rarely fatal. And so far as I understand, around 16,000 cases have been reported worldwide in 75 countries. Only 5 cases have died. So, it is not as serious or as complicated disease as the COVID has been. So again, I said these are early days and there is nothing to be panicked about. But yes, this sets an alarm, because, India is not an endemic country. So from where this patient has got the infection. So now this is the time when the public measures have to be intensified, our surveillance has to be, intensified. And if one case is there who is diagnosed, it means there are other cases around who might have, escaped through that, surveillance, and maybe another source of infection. So whatever close contacts who have been in, who have come in contact with him, any person who's come in contact with must be, thoroughly
but we
investigated.
can establish, doctor, that this is clearly an infectious disease. So anyone, if you know, has been in contact with the individual or the individual has caught it, that everyone else around must stay away, and this the patient needs to be in isolation. That is what is definitely sorted for an update of anyone listening to you right now.
Yes.
So, and also, can you explain that, are we looking at, may it not happen, but are we looking at any sort of a lockdown like the COVID pandemic, or that's too early to say right now?
At all, because see, it is the infectiousness is very limited. It's not as infectious COVID is, and the patient has to be symptomatic. Like in COVID, the asymptomatic individuals could also could spread the infection, but here it is not the case. So person has to be symptomatic. So you would know the person who is symptomatic can easily be isolated. So isolation also becomes easier. And plus we have the vaccines which are available. Of course, they have not been proven in this endemic currently, but those vaccines which were effective against the smallpox could be effective against this infection also. And some medicines are already available which are effective against smallpox, can also be used against this monkeypox virus. So there is nothing to be worried, but it doesn't mean that we become lackadaisical. We don't look into it, because it can cause serious morbidities. It can cause skin rashes and can cause permanent defacement of the areas. So one has to be careful.
Dr. Goel, please continue to stay with us. Dr. Suresh Kumar is back with us. He's the medical director of LNJP Hospital, and he's telling us about the first case in Delhi that is currently being treated by him. So glad to have you back. So we were talking about that patient. Now, sir, what are the identifying symptoms that anyone listening to you right now needs to know, that if that is a symptom that their body is reacting, they need to immediately contact the doctor? And is it infectious, sir?
It's infectious. If you have any patient with history of fever and skin rash, and if you have a history of international travel or any travel in the high risk area, number one, if you have the symptoms of fever with body ache, with skin rashes, typical vesiculopustular rashes and painful rashes in the skin, then one must go to the doctor, and as a part of physician and the dermatology team, we recommend that all these suspected cases must be tested for the virus. And we have, in this case also, we have sent the sample from the skin lesions and the blood test to the reference laboratory, and we got the positive report. So this is very important to identify the symptoms, and if patient have typical skin lesions, then one must be having high grade of suspicion on all these cases.
So any sort of rash, any sort of inflammation, they need to suddenly have that caution about. So because your audio is back again, sir, if I can go back to the patient that you're currently treating, and if you can give us a few quick details yet again, that this is not about a foreign travel, there were skin rashes, and now the individual is being treated at the hospital.
It is currently vitals are stable. He is recovering. He had history of fever 10 days back, and then he's the skin eruptions over the last 1 week, and now the patient is doing very well, and nothing to panic, because the more information about the transmission, about the disease, about the clinical spectrums, the method of diagnosis, how it's tested. So these are all important parameters that everybody must know, and how to protect healthcare workers and all the team, and at the same time how the general public can be more aware about the monkeypox virus, and what are the protective mechanism, what are the precautions that one must take. It is very important to know that it is a droplet transmitted virus, DNA virus, different from the COVID virus, and this spreads from human to human, and we have to wear the mask, and it is very important that we must observe this social distancing, and we must not share the bed sheets, clothes, patients, the close family contact should be avoided if patients have skin lesions and patients have fever, conjunctivitis and typical features of monkeypox.
How is it different from the coronavirus? Because it's important to understand that we must continue to take similar precautions which Indians are used to now for 2 years. But what can they add to, sir, to ensure that they do not catch the monkeypox as well?
See, the coronavirus is a RNA virus.
Yes.
This virus is different. It is a DNA virus. It primarily involves the skin. And there is no hypoxia or lack of oxygen, or you don't require any ventilatory support or oxygen support in monkeypox virus. In the COVID, we have seen that majority of these patients have cough, sore throat, low oxygen, typical COVID pneumonia, SARI-like symptoms. Here you have primarily the fever and skin problem. And then you have the conjunctivitis, you have the headache, and you have typical skin lesions, which are resembling the chickenpox-like eruptions in the skin, and there is a crust formation in the skin, and you have hyperpigmentation, you have umbilicated lesions, and the lesions are mainly over the face, trunk, legs, and on the palms also, which is differentiate from other viral illnesses. So typical classical vesicopustular lesion in the skin differentiated from other viral disease, and it hardly involves the lung.
That's very
Lungs
important.
are only involved in the immunocompromised patient.
What you're telling us, these are details that our viewers really need to know. Sir, two quick questions about the fatalities in this case. Are we looking at the smallpox vaccine that can be administered here as well? What are you looking at with regard to how dangerous this can be, Dr. Kumar? Because everyone has their alarm up, like it happened during the COVID pandemic start. What are we looking at with regard to the deadly aspect of this virus?
See, the smallpox is eradicated from India.
Yes.
After 1980, it is eradicated, and those who have received the smallpox vaccine, they are 85%, up to 85% protection against the monkeypox virus. It is seen in the various studies. So after 80, the population born after that is at risk, definitely, and the risk is much less than the COVID virus. We have seen that the case fatality ratio, as per the WHO figures, is around 3%, 1 to 3% in different subgroup population study from different countries. And so far, we have only around 70 deaths all over the world. So we can say that by and large, most of these patients do recover very well without any treatment, without any intervention, because 99% it is a self-limiting illness.
Dr. Suresh Kumar, just before I wrap up, it's a concern I'm sure all parents will have. I have a child at home, a toddler. Parents are asking if this virus, specifically the monkeypox, is affecting children. Should they be concerned? Or right now that risk level is low for children?
There is no need to panic. The cases in India is hardly, we have only single case in Delhi National Capital, and we have 3 cases in the Kerala. Nothing to panic. It is just beginning, and this virus is only seen in high risk group, IV drug abuser, MSM populations, homosexuals. So this type of virus we have seen, it's mainly originated in the African nations and mainly in the Europe and in America. In India, the situation is quite stable, and we hardly see
so skin-to-skin contact, sir, I think what you're telling us needs to be, is what people need to be cautious about. And so you're making a point, sir. Please finish your point, sir.
So it is very important that we must understand the various aspects of the virus, how it is transmitted, what are the clinical pictures in the children. Definitely, it is seen in the immunocompromised children where you have the immunodeficiencies.
So immunocompromised will be at a higher risk of that. Very important points. I really appreciate both the doctors here for giving us your views. Dr. Manoj Goyal and Dr. Suresh Kumar. And we are glad to know that the patient in Delhi is currently recovering. Thank you very much, sir, for all the latest, and hope our viewers have got some updated information.